So, it's my great pleasure to introduce one of the finest researcher in the field of endocrinology, Professor M.K. Lohiya, former head of the Department of Urology, Rajasthan University,
Where is the
Director,
pointer?
School of Life
Pointer.
Sciences. He is the recipient of several awards and a member of several bodies, including FNSC, FAMS, FIAES, FEMSI, and he is in the editorial board of several reputed journals. Professor Lohiya is the first one to identify the combination therapy for the male contraception using an anti-androgen saprophyton acetate and the androgen testosterone enanthate. Professor Lohiya is a recipient of Career Award, Nahat Sanman Puraskar, ICL Award, Apteshwar Award, and so many awards. If I started reading, it will take whole time. So, with this, I invite Professor M.K. Lohiya for his presentation.
Good afternoon. A delightful pleasure after enjoying academic feast since morning. I would like to take you a little away from what we have been listening since morning. And this is a story of almost 5 decades of our efforts in developing something what we call as a contraceptive for the male. Sometimes we talk that do we need it and why do we need it? When we say that there are several options available for the female, what are the options available for the male? And the current scenario of the population, and particularly about the Asian continent, we find what is the population like. And if we see in these world's most populous nations, our country is going to be the most populous country, and we are going to surpass China in times to come. Even today, we have more population than China. I will quickly go through some of the slides where we see that the cause of our population in our country, and I feel that the problem of all kinds is because of the overpopulation. We see the early marriages, illiteracy, increase in life expectancy, and lack of family planning. These are some of the reasons which are resulting into overpopulation. And you would be very pleased to learn that our country was the first to realize that we should have a family planning procedure, and so that we can limit our population. And it was as early as 1950s. But despite this, today we see that the scenario is different. And if we look into the female sterilization, we find that the female sterilization is almost 75 plus %, whereas the participation of the male is less than 1. This could be because of several reasons, and we like to talk about unending story of male contraception. For last 5 decades, several organizations spend a lot of energy, lot of funding, lot of effort in developing newer methods of male contraception, but we see that as on today, none. So we see the ideal contraceptive should have all these things, and the most important is be rapidly effective and fully reversible. This is the most important criteria. So we see that a drug development, how long does it take? You have to go through several steps, starting from the rodent model to lagomorph model to monkey model, and then finally you should see that it does not have a toxicological effect, and then it should be then only it would be allowed for clinical trials to be taken. So we looked into that what are the targets for achieving contraception. We find that you can have the inhibition of the spermatogenesis in the testes, we can have the impairment of the sperm function in the epididymis, and we can see that there can be prevention to the fertilization in the female tract. So this is our effort where we have worked in the past 5 decades hormonal methods, natural methods, and wasp-based methods. And I will quickly go through some of these slides where you will see that this is known to everybody, that this is the concept where in normal case we find from the hypothalamus GnRH release that is acting on the LHFSH of the pituitary, and in return we find testosterone is there secreted. When we talk of the contraceptive, we find that the testosterone is there, but with the diminishing levels of the circulating testosterone, we find that it will impair the libido. So the principle is inhibition of gonadotropin and androgen deficiency, and that can be taken through supplementation. So many efforts were made like androgen alone, progesterone alone, progesterone androgen combinations, androgen combinations, anti-androgen androgen combination, and DNRI and agonists. And these are the some of the efforts made all over the world, where we see that what are the efforts made and what is the outcome, like testosterone NSAID, testosterone decyclate, testosterone undupionate. These were used, and we found that because of some or the other side effects, they could not proceed beyond animal experimentation. So androgen implants were also tried, but again we find that the multiple and complicated delivery system limited further studies, and alteration in DST and estradiol levels, and very expensive. Progesterone alone also same effects on lytic cells, so production of the testosterone, circulating testosterone, inhibition of the libido, and requirement of the androgen supplementation. Similarly, progesterone androgen combinations were good, and we found that it is effective, provides long-term action. The problem when we see that anti-androgen androgen combination was the one in early 80s from our laboratory, where we found that ciproton acetate, when administered with Dr. MRN Prasad, he pursued a lot of work on this in Delhi University, and we were the first to demonstrate that if anti-androgen therapy is there, and if we can supplement with the exogenous testosterone, other different formulations like testosterone NSAID and other formulations, we found that yes, we can maintain the libido as well. And this type of thing, GnRH and agonist antagonists were also used, and similarly, lack of uniform efficacy, lack of systemic reactions, complex formulations, all these things limited. Only one slide I would like to last project about the efforts made about what you call the combination formulations, where we found that testosterone levels did not deviate beyond normal level, and this study was done in monkey model, that is the non-human primate model, and this based on this we found that several clinical trials were initiated using different formulations in combination, and unfortunately, as on today, we see that several efforts were made by several laboratories, but none is available as comparison to the availability of several contraceptives for the female. So, hormonal contraceptive will be increase weight, acne, and increase the hematocrit and hemoglobin levels. These were the main limiting factors in using hormonal formulations developing a contraceptive. Our lab was also involved that can we use natural products for developing effective male contraceptive, and in that case we found that compound is of natural origin, orally effective, cost effective, and so many advantages were there. So then we identify what could be the possible formulations. Looked into this, WHO made several efforts as early as 1976, and plant reached clinical trials evaluation 9. ICMR also. Yeah, okay. Oh, sorry. I was pressing this. Just a minute. Okay. So then what we did is several of these studies were conducted, and we found that despite Central Research Institution, ICMR, WHO, all that, several studies were done, but none could proceed beyond some level. So we identified which are the plants which are showing potential, and out of this we selected Carica papaya, and we subjected this to several extraction, isolation, identification procedures, and this is a long procedure, and we found that MCP1 is the one which is a compound very effective. This was done in rate models, and we found that various formulations were used. I will just quickly go through and put you the highlights of this, and several clinical experiments were conducted to see whether in terms of efficacy, in terms of side effects, and how does it work. So we found that it impacts sperm motility. That was a wonderful experience we had, and the sperm viability and 10% normal drastically affected spermatozoa motility and also morphology. So this continued, and various formulations were tried. We also spermatogonial chromosomal aberration test were done to see whether it has any toxicity. Spermatogonial chromosomal aberration tests were also done, and then rodent dominant lethal assays were also done. Then several of these findings were published in almost journals all over the globe, and we found very good response, and some of our findings were published in the cover page of the Asian Journal of Neurology and other journals. And after this, we found that can we proceed with the monkey studies, and Lemur monkey studies was essential to go for clinical trials, and this was supported by Ministry of Health and Family Welfare, Government of India, and we found that in 30, 60, 70, this is the only study which is being conducted age long, age 360 days. And then we subjected this to reversal, and we found that in the initial phase, there were some phases where the sperm count reduced to level, and this is the sperm concentration, and then we found that after a particular interval, the animals showing the azoospermia, no sperm in the ejaculate. And only we found that subsequent to stopping the treatment, we found that slowly they come back to pre-treatment levels. And interestingly, sperm motility impairment was there. So even if voided sperms are there in the ejaculate, we found that those sperms were not having the motility. So the animals could achieve a contraception much before they become azoospermic. This was a very interesting finding, and in sperm motility of langur monkeys treated with isolated compound MCP1 methanol subfractions. So several of these fractions were used, and subsequently several of these findings were published. Later we found that can we use these formulations through the what you call methoxy polyethyl glycol polymeric monomethyl loaded capsules, and we found that yes, we can reduce the dose regimen, and we can also see that the effects are very, very potent, and these are the sperms collected from the vagina of the animals subjected to mating experiments with the male treated with the formulation MCP1. And interestingly, you will find that in these groups, all the animals showed zero fertility, and also subjected to other toxicological parameters, and we found that yes, they are acceptable. So the purified compound of the seeds of Carica papaya loaded found polymeric nanomethyls, they are effective. With this, we left it to the clinical trials. Ministry of Health and Family Welfare, looking into our data, wanted that please don't go for further isolation and characterization. You can proceed for the clinical trials, but it is in preclinical approval, and thereafter the steel painting. The another approach which I would like to share quickly with you is the wash-based method for male contraception. And we are all aware that vasectomy is a very popular procedure available and it is very simple. But we find that large number of people are using whatever, and the main problem is the reversal, less assured despite surgical success. So we find that surgical success requires skilled surgical intervention, and despite the physical assurance of the reanastomosis, but the functional assurance is not there because the pregnancy cannot be achieved and cannot be assured in 100% cases. So we found that no scalpel vasectomy, it has several advantages against the vasectomy, but the main issue was again the no assurance of the successful reversal. So this, based on this, Government of India wanted that should we not look into some other thing where these were some of the efforts made using wasp-based contraceptives, but none of them had the same problem. Reversal requires microsurgical intervention and it is less assured. Professor Guha from All India Institute of Medical Sciences and IIT Delhi was the one who came out with a formulation in early 1979, and he said that yes, there is a formulation called Risuk which could be useful. So this is the formulation Risuk, which is the synonym of the reversible inhibition of sperm under guidance, is an injectable intravenous male contraceptive, and it's a polymer where we find the styrene and many anhydrate dissolved in what you call as DMSO, and it forms the Risuk. So with this, we took up studies in langur monkey, and our main focus was also to see whether we can achieve reversibility. And interestingly, you find that the same of the langur spermatozoa from pre-treatment samples, we find that normal and age early age different intervals starting from first ejaculate to subsequent ejaculate till we got the sperms in the ejaculate, voided sperm, we found that there are various sperm abnormalities seen in the ejaculate. Very interestingly, we found that this was the picture where initially, prior to Risuk injection, this is the scenario like where you can find large number of sperms in the ejaculate, but subsequently at different intervals starting from 30 days, 60 days, we find that hardly there are sperms present in the ejaculate, and if present, they have a sperm morphology impaired. So they are not capable of fertilization. Then we see sperm morphology of the langur monkey, first ejaculate on same day of non-invasive reversal. And finally we found at 20 or subsequent intervals, the sperm parameters came to normal. One slide, I would like to invite your attention where we see that the reversal, the animals were subjected to non-invasive reversal, and all the animals who reversed to normal pre-treatment sampling, this is the scenario where we find that 200 plus sperm counts were there in the ejaculate, and we subjected these animals to second occlusion. And again, when we found that 3 subsequent agiospermic samples were there, then we subjected them to second reversal. And this is the first of its kind effort in developing male contraception, where we can see that subsequent intervals, slowly we found that the normal sperm counts are seen. The most challenging task was that it is in the monkey, and we had limited resources to go for mating experiments in the monkey. So what we did is that we can find out the fertilizing ability of these sperm present in the reversal animals through sperm functional test, and we found that sperm functional test approved by the WHO, they were positive. So this is the sperm motility parameters in monkeys, and sperm motility, again we found that sperm motility is almost nil subsequent intervals, and we regain at different intervals. So this is the first reversal, second occlusion, and second reversal, and this is being done. This was published in International Journal of Andrology, and with a priority. Once we communicated, they said we would not charge any article processing, and we would publish it in priority issue, and they did it. And subsequently, we did reversal studies with DMSO and sodium bicarbonate, because these are the two chemicals which dissolve the resource, and we did it in rat and rabbit models, and we found that this is the scenario like first in the normal animals and subsequent after resource injection, and this is the thing after reversal with either of these two formulations. And this is the scenario where you see that at age long age 360 days, these studies were conducted, and we find that what is the scenario post injection, the animals become almost sterile. Similarly, in rabbit model. So I will quickly go through it. And several studies were done using scanning electron microscopy. And what happens to this spermatozoa after different intervals of ejaculation or after different intervals of the mating experiment, we find that interesting observations were made in the sperms present in the female reproductive tract. And we collect them in the next day morning, subject them to scanning electron microscopy, and these are the pictures presented. Then the clinical trials were done, and you all know that unless the study is being approved by the Drug Control General of India, we cannot proceed. And they would need data studied in rat as a rodent model, rabbit as a legomorph model, and monkey as a rodent non-human primate model. Then only the clinical trial approval will be there. So the clinical trial, phase 1 clinical trials were conducted, and we found that yes, this was conducted in 47 male subjects, and using DMSO SMA mixtures into this, and we found that no long-term adverse effects were seen. Then phase 2 clinical trials were conducted, and again we found that the outcome in all subjects was sustained azoospermia, and administration of 60 milligrams SMA in each was different, resulted in azoospermia pregnancy protection beyond 1 year. That was only a small study being done. And thereafter, we find the extended phase 2 clinical trials were conducted. Again, the pregnancy protection was obtained in all the male and female partners used to visit, and we would follow it up and then see that there is no pregnancy. After this, we found that phase 3 clinical trials, which is the study to be done before going for the mass application. And in this, we found obtained sufficient evidence about the efficacy safety of Risug in large number of the healthy subjects. And this was supported by Ministry of Health and Family Welfare, and also subsequently the monitored and also supported financially by the Indian Council of Medical Research. Now, in our laboratory, we found that early contraception, a very interesting observation where the male partners who were subjected with the Risug, they early age in 21 subsequent days, we found that the sperm count goes very down, and we achieved the, prior to azoospermia, we achieved the sperm motility, sperm viability, sperm morphology, all these become acceptable as a contraceptive. And then subsequently we find that long age 5 years, 7 years studies were conducted. I am presenting data only for 5 years, but 7 years follow-up studies were conducted in these male partners, and we found that it is very, very effective preposition. So then several of the functional inactive, or as I told you, that we do it because again, this is not possible to conduct the mating experiments in human subjects. So what we did is that the oided sperms which present in the initial ejaculates of the male partners, we subjected them to functional tests, and these functional tests indicated that the functional inaction of sperm by Risug, and we found that what is this picture like? Sperm functional test in oided sperms before azoospermia, after reversal inhibition of sperm under guidance injection. This is the schematic representation, and we find that the sperms, they show the inability. And ultrastructure of the spermatozoa from subjects before and after Risug injection, we see that normal pictures were seen. And then subsequently we found that there were different types of abnormality, head-tail separation, the curvature of the sperms, and so many things were seen in these ejaculates. And the semen biochemical parameters were, these were some of the academic interest, but also it was required by the ministry that we should give detailed information about the hormone profile subject to this. We conducted studies like testosterone, FSH, LH, several of these cortisol, and we found that there is a fluctuation, but they remain within a controlled range. So the PSA, that was important. If I am short of time, please let me know. Another 2 minutes, 3 minutes, I'll say. So here we see, interestingly, that in vasectomic assays, the PSA impairment is PSA or sperm antibody. You know that the sperm antibody titers in vasectomized cases is one of the regions where the successful reanastomosis anatomically does not lead to functional success. And they say that it could possibly one of the reasons could be antibodies formation, where we monitor PSA as well as antibody at as long as 7 years in these subjects. And also we proteomics, we did the gel electrophoresis of the semen parameters, and this is the scenario, and we found how many spots are there, what type of proteins are there, and what is the significance of these proteins, and these multi-spectra were obtained, then identified proteins through this is accelerated studies being done, and highlights of ongoing phase 3 clinical studies. Then we see that age was 1.2% subject showed mesothelioma, which is comparable to vasectomy or no scalpel vasectomy. The second thing is efficacy of risk for pregnancy production was 99.02%. Again, very high efficacy. The post-injection voided sperm before the subject became azoospermic lose their fertilizing ability as judged through sperm function test. That is a very important finding, that even if we see that the voided sperms are there in the ejaculate, the subjects can be assured that you are sterile because the morphology impairment is there. The reversibility has been well documented in animal models. Unfortunately, the number of subjects coming for Risuk injection is limited, and it is a contraceptive in a healthy human beings. So we cannot ask them to volunteer for reversibility. It is not the animal model. So that is the limitations, we could not do it. So phase 3 clinical trials again published in a number of journals, and we see that we are getting very good response. Number of countries like US, Germany, several, they are asking whether we can opt for the volunteer for Risuk injection for contraception. So that is the beauty of this. So overpopulation, in my opinion and opinion of many, is the main cause of all problems in our country. We should have some options available for male to join the procedure of family planning as much as of a female partner. So this is the male contraceptive, the future where the burden to control the population should be shared by the male partners. Thank you so much. Large number of the agencies supported all through, sometimes ICMR, sometimes Department of Biotechnology, Ministry of Health and Family Welfare, UGC, Special Assistance Program, so on and so forth. And finally, I would like to say, I would like to dedicate it to all PhD students and postdoctoral fellows, large number, who during the course of these studies contributed. And finally, I would also like to acknowledge my wife, who is there in the audience, that she allowed us to work long hours in the lab so we could achieve something as I could.
Thank you, sir. If you're running out of time, one question from the audience.
Sir, excellent journey.
Thank you so much.
Congratulations.
Thank you so much.
Sir, my maternal side of family belongs to Ayurvedic physicians, and my grandmother had told me very long ago, when you cut papaya, see that you don't give the seeds to anybody, because it can prevent spermiogenesis and also oogenesis. So have you tried it on ovum?
In fact, our focus was only to see whether to develop a male contraceptive. But what you say is true. In the literature, we find large number of such reporting where it can result into termination of the early pregnancy. Yes. So they advise that the females which are pregnant should avoid taking the papaya. Very true. Thank you so much. I think
Sir.
we can have more discussion anytime. I'm here for last another 2 days. So I enjoyed when presence of Lakotia Saab. I admire him, and many of our very distinguished lifetime achievement awardees are there, and the audience. I would like to say that a quality of science which I have seen from the early morning, and the selection of the abstract where I see both Professor Chobe and Professor Ras, they are very meticulously looking into selection of all abstract, quality publications, quality presentations. I admire both of them and their team for making this possible. Thank you so much.
Thank you, sir.
We are very glad and introducing
Sir,
Professor
I
G.
just
K.
felicitate
Prabhakar,
three of
the
you at one
professor
go,
at
sir.
IIT
Thank
Delhi.
you so much, sir,
He
for the great
recently
talk.
did MTech
Yes.
in